Today, we're diving into a fascinating medical detective story. It's all about a rare condition that looks and feels like a very serious illness, but as you'll see, it has a surprisingly hopeful twist. We're going to break down something called Meigs syndrome.
So picture this. A patient, usually an older woman, shows up at her doctor's office. Her belly is swollen and it hurts. She's struggling to catch her breath. And she is just wiped out, completely exhausted. At first glance, these symptoms don't seem to have much in common. But finding the link between them, that's the very first step in solving this whole medical mystery.
All right, so the investigation begins. Doctors start running tests, and as they do, they begin to see a very distinct pattern emerge, a specific trio of findings that really form the core of this puzzle.
Okay, the first major clue is right here, inside the chest. What you're looking at is a chest X-ray showing a massive pleural effusion. See that whole white area down at the bottom? That's fluid that has collected around the lung, and it's literally squeezing it, which makes it incredibly difficult to breathe. This right here explains that shortness of breath.
This slide really lays out the whole puzzle for us. We've already got clue number 1, that fluid around the lungs, the pleural effusion. But then, in the abdomen, scans show something called ascites. That's the fluid causing all that painful bloating. And finally, they find the source, a solid tumor on the ovary. So you have a tumor, fluid in the belly, and fluid in the chest. This is the classic triad we're talking about.
Now, when a medical team sees this triad of symptoms all together, well, that sets off some serious alarm bells, because in the vast majority of cases, this specific combination of findings points to something really serious.
You have to understand, when doctors see this, all of their training, all of their experience points them towards one pretty grave conclusion. I mean, a tumor in one spot with fluid spreading to 2 other parts of the body, that's a textbook sign of an advanced, spreading disease.
And that diagnosis is metastatic ovarian cancer. It is the most logical and, frankly, the most common explanation for this clinical picture. The immediate assumption has to be that cancer has spread from the ovary into the lining of the abdomen and the chest.
And this is really the heart of the problem. You can just imagine, for the patient, for the doctors, this is an absolutely terrifying moment. All the signs are pointing to an advanced cancer, which makes the next steps critical. It's a huge clinical challenge.
But here comes the twist. This isn't cancer. It's Meigs syndrome, a rare condition that is the ultimate imposter. The crucial difference, the entire ballgame, is that the ovarian tumor, which is often a type called a fibroma, is completely benign. It's not cancerous at all, yet somehow it's causing all these alarming, widespread symptoms.
And really, this comparison says it all. On one side, you've got ovarian cancer, a malignant tumor, complex treatments, and an uncertain prognosis. But on the other side, Meigs syndrome, a benign tumor, completely curable with just one surgery, and the patient goes on to have a normal life expectancy. I mean, it is a night and day difference.
So, who figured all this out? Well, the syndrome gets its name from an American gynecologist, Dr. Joe Vincent Meigs. Way back in 1937, he published a paper on 7 cases where this exact scenario played out. They removed the tumor, and boom, everything was cured. By 1954, he'd formalized the criteria for this incredible condition.
Okay, so this brings us to the big scientific question, right? How on earth can a tumor that isn't cancerous cause so much chaos all over the body?
I mean, this is what baffled physicians for years. The tumor isn't spreading like a cancer. It's not invading other tissues. So how does a benign lump in the pelvis lead to fluid in the abdomen and all the way up in the chest?
Well, the leading theory is this really fascinating chain reaction. It all starts with the tumor itself, which releases these inflammatory signals. These signals then make the tiny blood vessels in the abdomen, the capillaries, kind of leaky, so fluid seeps out, and that's what creates the ascites. Then, and this is the final step, that fluid gets drawn up through tiny channels in the diaphragm, right into the chest, and that's what causes the pleural effusion. It's an incredible journey.
And get this, here's a really cool detail that backs this whole theory up. In about 70% of Meigs syndrome cases, that fluid in the chest is on the right side. And why the right side specifically? Because it turns out the little lymphatic channels in our diaphragm just happen to be bigger on the right, giving the fluid an easier path to travel.
So, let's get to the final act. How do you officially solve this case? And more importantly, how do you fix it for the patient?
Well, here's the crazy part. Meigs syndrome is what we call a diagnosis of exclusion. You can suspect it, you can be pretty sure it's what's going on, but you can't be 100% certain until after the tumor is surgically removed. The surgery itself is both the treatment and the final diagnostic test.
This might just be the most powerful image of them all. On the left, there's that X-ray from the beginning, the lung totally clouded and squished by all that fluid. And on the right, the aftershot. Once that benign tumor is taken out, the fluid just vanishes. The lungs are totally clear. This dramatic resolution is the final clue that solves the entire mystery.
In fact, that resolution, the fact that the fluid goes away, is the final official piece of the diagnostic puzzle. To have Meigs syndrome, you need the triad of a benign tumor, ascites, and pleural effusion, and all that fluid has to completely disappear after the tumor is gone. The cure is literally part of the diagnosis.
So why does this super rare condition matter so much? I mean, it only happens in about 1% of these kinds of tumors, but the lesson it teaches is huge.
It matters because it's a powerful reminder for doctors everywhere to keep an open mind and to always consider this great mimicker. It proves that even the most frightening set of symptoms can have a completely benign cause. And ultimately, it's a diagnosis of hope. It's proof that what looks like a dire, incurable disease can sometimes be completely fixed with a single surgery.
And that kind of leaves us with a final thought, doesn't it? Meigs syndrome is this perfect example of a medical condition that just completely defies expectations. It really makes you wonder, in this huge, complex world of medicine, what other great mimickers are out there, just waiting for us to unravel their secrets.